Hello and welcome to this video about the relationship between anemia and chronic kidney disease, CKD. If you or someone you know is living with CKD, you may be familiar with the impact that anemia can have on overall health and well-being. Anemia is a common complication of CKD, and it can significantly impact the quality of life for those affected. In this video, we will explore 5 helpful pieces of information about anemia and CKD, including its prevalence, impact on symptoms and quality of life, consequences on CKD progression, treatment options, and monitoring and management. By the end of this video, you will have a better understanding of the relationship between anemia and CKD and how to manage this condition effectively. Remember, this information is for educational purposes only, and you should always consult with a healthcare professional for personalized advice and guidance. So, let's get started. 1. Prevalence of anemia. Anemia is a common complication of chronic kidney disease, CKD, that affects a significant number of individuals, particularly those with advanced CKD. As CKD progresses, the kidney's ability to produce erythropoietin, a hormone responsible for red blood cell production, declines. This decrease in erythropoietin leads to a reduction in the number of red blood cells, resulting in anemia. Research and studies have shown that the prevalence of anemia in patients with advanced CKD is remarkably high, estimated to be as high as 90%. This means that a vast majority of individuals with advanced CKD experience anemia at some point in their disease progression. The impact of anemia in CKD can be significant. It contributes to symptoms such as fatigue, weakness, shortness of breath, dizziness, and cognitive impairment. These symptoms can have a detrimental effect on an individual's quality of life, limiting their physical activity, decreasing productivity, and affecting overall well-being. Furthermore, anemia in CKD is not only a quality of life issue but also has implications for the progression of the underlying kidney disease. The reduced oxygen carrying capacity of the blood due to anemia can lead to tissue hypoxia, which may further damage the kidneys. Additionally, anemia in CKD is associated with an increased risk of cardiovascular complications, including heart failure. To address anemia in CKD, various treatment options are available. One common approach involves the use of erythropoiesis-stimulating agents, ESAs, which are synthetic versions of erythropoietin. These medications stimulate red blood cell production. Additionally, iron supplementation may be necessary to maintain adequate iron stores required for effective ESA therapy. In some cases, blood transfusions may be required to manage severe anemia. Regular monitoring of hemoglobin levels is crucial in managing anemia in CKD. Healthcare providers often recommend frequent blood tests to assess hemoglobin and iron levels, along with other relevant parameters. Close collaboration with a healthcare team is essential to determine the most appropriate treatment approach based on individual needs and circumstances. By understanding the prevalence, impact, consequences, and treatment options for anemia in CKD, individuals and healthcare professionals can work together to effectively manage this condition, improve symptoms, slow disease progression, and enhance the overall well-being of those living with CKD. 2. Impact on symptoms and quality of life. Anemia has a profound impact on the quality of life of individuals with chronic kidney disease, CKD. It manifests through a variety of symptoms that can significantly affect daily functioning and overall well-being. Common symptoms experienced by individuals with anemia in CKD include fatigue, weakness, shortness of breath, dizziness, and cognitive impairment. Fatigue is a prevalent symptom and is often described as an overwhelming sense of tiredness or lack of energy. Individuals with anemia in CKD may find themselves constantly fatigued, even after minimal physical or mental exertion. This persistent fatigue can severely limit their ability to engage in regular activities, leading to a decreased quality of life. Weakness is another common symptom associated with anemia in CKD. It refers to a general sense of reduced strength and inability to perform tasks that were previously manageable. This weakness can make even simple daily activities, such as climbing stairs or carrying groceries, challenging and exhausting. Shortness of breath, known as dyspnea, is often reported by individuals with anemia in CKD. It can occur during physical exertion or even at rest. The reduced oxygen carrying capacity of the blood due to anemia forces the heart and lungs to work harder to compensate, resulting in feelings of breathlessness. Dizziness is a symptom that can be particularly concerning for individuals with anemia in CKD. They may experience lightheadedness, unsteadiness, or a sensation of spinning. Dizziness can pose a risk of falls and accidents, further compromising their daily activities and quality of life. Cognitive impairment, such as difficulties with concentration, memory, and mental processing, can also arise due to anemia and CKD. This can manifest as brain fog or difficulty staying focused, leading to challenges in work, social interactions, and overall cognitive function. Collectively, these symptoms of anemia can have a substantial impact on physical, mental, and emotional well-being, limiting physical activity, decreasing productivity, and diminishing overall quality of life for individuals with CKD. Recognizing and addressing these symptoms is crucial in managing anemia effectively and improving the day-to-day experience of those living with CKD. 3. Consequences on CKD progression. Anemia in chronic kidney disease, CKD, is not only a standalone concern but also has important implications for the progression of the underlying kidney disease and overall health outcomes. It is associated with an increased risk of CKD progression and adverse consequences. One of the primary reasons anemia can impact CKD progression is its effect on tissue oxygenation. Anemia reduces the oxygen carrying capacity of the blood, leading to a state of tissue hypoxia, where organs and tissues do not receive an adequate supply of oxygen. In the context of CKD, this can have detrimental effects on the kidneys themselves. The kidneys, which are already compromised due to CKD, require sufficient oxygen to function optimally. When anemia-induced tissue hypoxia occurs, it can further impair kidney function, potentially exacerbating the progression of CKD. Furthermore, anemia in CKD is associated with an increased risk of cardiovascular complications. The heart works harder to compensate for the decreased oxygen carrying capacity of the blood, leading to increased cardiac strain. Over time, this can contribute to the development or worsening of cardiovascular conditions, including heart failure. Cardiovascular disease is a leading cause of morbidity and mortality in individuals with CKD, and anemia further adds to this risk. Understanding the potential consequences of anemia on CKD progression underscores the significance of early detection, proactive management, and regular monitoring. By addressing anemia effectively, healthcare providers can help mitigate the risks associated with CKD progression and improve long-term outcomes for individuals living with this condition. 4. Treatment options. The treatment of anemia in chronic kidney disease, CKD, involves various approaches aimed at addressing the underlying cause and optimizing red blood cell production. The primary treatment options for anemia in CKD include the use of erythropoiesis-stimulating agents, ESAs, iron supplementation, and, in severe cases, blood transfusions. ESAs are synthetic versions of erythropoietin, the hormone responsible for stimulating the production of red blood cells in the body. These medications work by mimicking the action of erythropoietin and stimulating the bone marrow to produce more red blood cells. ESAs are typically administered via injection, either subcutaneously or intravenously, and their dosage is adjusted based on individual needs and response. Iron supplementation is often necessary in individuals with anemia in CKD, as iron plays a vital role in red blood cell production. In CKD, iron stores can become depleted due to various factors, including decreased absorption and increased blood loss. Oral iron supplements are commonly prescribed to replenish iron stores and support the effectiveness of ESA therapy. In some cases, intravenous iron therapy may be required, especially if oral supplementation is ineffective or not well tolerated. In certain situations, blood transfusions may be necessary to manage severe anemia in CKD. Blood transfusions provide an immediate increase in red blood cell count and help alleviate symptoms associated with anemia. However, transfusions are typically reserved for cases where anemia is severe or when other treatment options have not been successful. It is important to note that the treatment approach for anemia and CKD should be individualized based on factors such as the underlying cause, severity of anemia, and overall health status. Healthcare providers play a crucial role in determining the most appropriate treatment plan for each patient, considering their unique needs and circumstances. Regular monitoring of hemoglobin levels and response to treatment is essential in managing anemia effectively. Healthcare providers may recommend frequent blood tests to assess hemoglobin levels, iron status, and other relevant parameters to guide treatment decisions and ensure optimal outcomes. By utilizing a combination of ESAs, iron supplementation, and, when necessary, blood transfusions, healthcare providers can effectively manage anemia in CKD, improve red blood cell production, and alleviate the symptoms associated with anemia. Close collaboration with a healthcare team is key to determining the most suitable treatment approach and ensuring ongoing monitoring and adjustment for optimal results. 5. Monitoring and management. Regular monitoring and proactive management are essential in effectively addressing anemia in chronic kidney disease, CKD. Healthcare providers play a crucial role in monitoring hemoglobin levels and other relevant parameters to detect anemia promptly and tailor the treatment approach to each individual's needs. Hemoglobin levels, which indicate the amount of oxygen-carrying red blood cells in the body, are key markers used to assess anemia in CKD. Regular blood tests, such as complete blood count, CBC, or hemoglobin testing, are recommended to monitor hemoglobin levels over time. The frequency of these tests may vary based on the severity of anemia, CKD stage, and individual patient factors. Close monitoring allows healthcare providers to identify any changes in hemoglobin levels and make timely adjustments to the treatment plan as necessary. In addition to monitoring hemoglobin levels, healthcare providers may assess other parameters to gain a comprehensive understanding of anemia in CKD. These parameters may include iron levels, ferritin, transferrin saturation, and total iron binding capacity. Evaluating these factors helps determine the underlying cause of anemia and guide treatment decisions. For example, low iron levels may indicate the need for iron supplementation alongside erythropoiesis-stimulating agents, ESAs. Collaboration between individuals with CKD and their healthcare team is crucial for effective management of anemia. Open communication and regular follow-up appointments enable healthcare providers to closely monitor the individual's response to treatment, adjust medication dosages as needed, and address any concerns or side effects. Individuals should actively participate in their care by reporting any changes in symptoms or overall well-being to their healthcare provider. Furthermore, maintaining a healthy lifestyle can support anemia management in CKD. This includes following a balanced diet rich in iron and other essential nutrients, staying adequately hydrated, and engaging in regular physical activity as permitted by individual health conditions. Lifestyle modifications may contribute to improved treatment outcomes and overall well-being. By regularly monitoring hemoglobin levels, assessing relevant parameters, and maintaining close collaboration with a healthcare team, individuals with CKD can effectively manage anemia. Early detection and timely intervention can help minimize symptoms, slow disease progression, and improve overall quality of life.